By now, you may have heard of the healthcare reform initiative being implemented, known as DSRIP. And like many others, you may have questions about what this means for you, your workplace, and even the healthcare system across the state. Before we explore the details of the program, let's quickly look at the basic question on many people's mind. What is DSRIP? DSRIP, like so many terms in healthcare, is an acronym and stands for Delivery System Reform Incentive Payment Program. It is a federally funded initiative that seeks to dramatically restructure and improve healthcare delivery, particularly for the Medicaid population. To date, since 2010, 7 states have launched DSRIP programs, with New York officially coming on board in 2014. While there are specific objectives to be met under this reform program, the primary goal is simple: the reduction of avoidable hospital use by 25% over a 5-year period. To finance this massive undertaking, the federal government is reinvesting $6.4 billion into New York's healthcare infrastructure. In order to align objectives and collaborate toward mutual goals, regional providers across the state have formed partnerships called Performing Provider Systems, or PPSs. These governing entities will oversee the implementation of DSRIP initiatives within their respective facilities, including the transition from a fee-for-service billing model to the new value-based payments system. PPSs will carry out many of the DSRIP objectives by implementing state-approved projects. While projects aren't the only method of changing the delivery system, they are a primary tool for the PPS to affect key health outcomes. While some facilities may be participating in many projects, others may only be implementing one or simply be a participant in the integrated network of healthcare providers. And once fully operational, the projects and the network will work together to achieve the overall goal of reducing avoidable hospitalizations. Community Partners of Western New York is participating in 10 of the DSRIP projects with a diverse range of application. From equipping community-based and behavioral health organizations with the means to promote the utilization of primary care, broadening telemedicine practices to create access to care for geographically isolated patients, increasing palliative care in patient-centered medical homes, reducing negative pregnancy outcomes and premature births to promote better health for children and their mothers, implementing disease management and healthy living practices to include tobacco cessation programs, and delivering effective care coordination within emergency departments to reduce readmissions and link patients with a primary care provider. These projects are designed to improve the delivery and quality of care and increase patient understanding of their own health, ultimately reducing hospitalizations. Achieving the objectives of the DSRIP program takes many talented and innovative individuals working as a team to ensure the transformation is successful in our state. Serving as a neutral workforce development and education resource, the Western New York Rural Area Health Education Center, or Rural AHEC, has already been actively collecting workforce data to support the PPS-attested facilities under DSRIP. By now, administration at your facility has most likely completed both the current workforce and compensation and benefits surveys, as well as met with a Rural AHEC training coordinator to conduct a face-to-face training needs assessment. The information collected is aggregated and analyzed, and has been used to create the gap analysis and to build a transition roadmap and DSRIP training strategy by the PPS. But Rural AHEC's role doesn't end there. Workforce assessment will be an ongoing process throughout the length of the program. Working with DSRIP teams as well as directly with the attested facilities, Rural AHEC will be ever present and continually assessing the current workforce state to ensure the PPS has a clear picture of the system integration challenges being faced, as well as collecting the evident training needs of their partners. As a valuable member of the healthcare workforce, you play a vital role in the success of DSRIP. Your knowledge and understanding of how population health will be improved will will touch the lives of millions across the state. Are you ready for the challenge?